Without the Christian County Health Department and this program, we'd be having a bad ending to this story rather than a happy ending.
And I am Joan Lang, the Cancer Control Specialist with the Kentucky Cancer Program for the Penny Royal Area Development District. This is the Kentucky Colon Cancer Screening Program, and funding for that comes from two sources. One is through the General Assembly, actually the governor, and secondly, the Kentucky Cancer Foundation is matching, so we have $2 million spread throughout the state. All 52 health departments are eligible. We had, in the first fiscal year where this was available, we had 11 health departments apply. 1 dropped out and 10 were awarded funds, including Christian County. We screened individuals, and those individuals that need to be screened were those without insurance, who were income eligible. There was some age guidelines too, beginning at age 50 or 45 if you're African American. And it was a simple process. You just picked up the phone, dialed the telephone number, and made an appointment to come in. And there are 2 nurse practitioners who are navigators for this program. You speak with one of them. You have a short interview. They ask you some questions. They're interested in knowing your family history, if you're having any symptoms. And based upon that interview, one of 2 things will happen. Either you will be sent straight for a colonoscopy, or you'll get a take-home stool sample kit, which needs to be returned. And then it'll analyzed, and then you'll get the results of that analysis.
My name is Callie Wells. My role in the grant was, in the process, was to apply for the grant. It was a partially state-funded and privately funded grant. And so, based on the fact that our community health assessment identified colon cancer as a need, and we had locally funded that initially, it was just a no-brainer that we would apply for the funding, so that would be covered through state funds and not local funds. Well, Janine and I, we're both nurse practitioners here. We are considered what the program calls patient navigators. And as a patient navigator, it's our job to screen those individuals to see which screening they're eligible for, whether it's the colonoscopy or the FIT kit, and then just navigate the patient through that process.
I was trained as a patient advocate in order to be able to get people enrolled in the Kentucky Colon Cancer Screening Program. So we went through a training in order to do that. And being clinical, it was probably a little bit easier for Callie and I to both do that because we were aware of signs and symptoms, those type of things. So we were trained to do that. We were the ones that were able to get people signed up that didn't have any insurance. I mean, that was our job to do that, to see what was medically necessary, if the patient qualified to have the fecal immunoassay test, or if they actually qualified to go straight to colonoscopy. So that was our job to determine that. Of course, the Kentucky Colon Cancer Screening Program, gave us the materials, to be able to, whatever eligibility criteria, that we had to go for with that, to be able to determine that. But, it was just, good for us to be clinicians in order to know, exactly, what we needed to do to try to get somebody qualified to do that. So, since we have been involved with the Kentucky Colon Cancer Screening Program, we've actually issued 123 FIT kits. So, and those are the fecal immunoassay test. We've had 103 of them completed, okay? And also we've had 50 colonoscopies completed. So we were very fortunate that many of our patients were able to complete the FIT test, which is a great thing. And not necessarily would they have any maybe, like any family history or anything like that. But, if the FIT test came back positive, then, then we would be able to give them the colonoscopy. So not everybody that came here, immediately got a colonoscopy. They were able to get the FIT test. And a lot of times with patients, the least that you do, they're okay with. They're like, oh, well, if you've done it yourself, it becomes a lot easier for them to do it as well. So, trying to be less invasive at first, I think, is probably a good way to go if you're able to do that. So, anyway, so it was really good. We have so many people that come here already that we were able to do a lot of in-reach, not just outreach. So we were able to, get a lot of our patients from our hypertension program, our diabetes program, through the women's cancer screening program. Sometimes people just coming up for maybe to get immunizations that they felt, that they were at that age, we would be able to talk to them about it. And then of course, we had several days where we just, had people just come in to be screened, just to see what they would need. So that's the reason we have such really good numbers.
Well, the central piece are the health departments, and here it's Christian County Health Department. Kentucky Cancer Program is contracted to work with the health departments to bring people in for screening. We don't do any of the clinical evaluation. That's strictly health department personnel and the hospitals and physicians then that are contracted to see the patients and do the colonoscopies. So it's a collaboration amongst really the healthcare providers and Kentucky Cancer Program.
Colon cancer is one of the most deadly cancers out there, yet it's one of the most preventable if people were more proactive about their health. But here in Christian County, we've discovered that a lot of people aren't very proactive about their health simply because they don't have insurance, they can't afford it. So we saw a need, and in 2010, the Christian County Health Department Board of Health, they allotted $10,000 to the Christian County Health Department for them to use to start a colon cancer program. And we partnered with a few physicians in the community, and we were able to provide free screenings to patients who were income eligible and met the requirements. We had some requirements for that, but if they did meet the requirements, we could provide those services for them without insurance, and then we could refer them for a colon cancer screening and for a colonoscopy should they need it. In 2012, we were very successful with that 2010 program. So in 2012, the Kentucky Cancer Program allotted us money to use to continue this colon cancer program. And we've since then been able to make more partners in the community, and we're able to help more people in the community, and we've had some great success stories with this program.
My name is Janice Civils. I am the Christian County Coordinator for the Disproportionate Minority Contact.
I'm Mike Civils. This is my wife, and I'm retired.
In 2009, the factory that my husband worked at closed down. All the employees were displaced at that time, which left us without insurance. I had found out about the health department programs through the women's program at the convention center. I went to that, and they set up an appointment. We came to the health department, ended up going through their clinic here, and they offered us a free colon screening. Neither myself nor my husband had ever had a colon screening, and so we went and had that done, and I was very lucky. I had a good report from it. I didn't have to have anything else done, and don't have to have another one for 5 years.
I had my colonoscopy also, and I actually had mine before she had hers. We kind of flipped the coin. I went first, and so they found he got in. He removed a lot of polyps from my colon, and he couldn't get to a bunch more of them. So he scheduled me for, I think that was like the 4th of August. No, it was like the 4th or 5th of August. So he scheduled me for surgery on the 15th of August to 13th. Well, Dr. Van Meter, never met him before. He worked with us without not having any insurance also, and give us a pretty good deal, payments and stuff on that order. And they were going to go in through the navel, and that did not work because there was too many polyps in there, so he had to do a colon resection, and they took out 1.5 foot 2 foot of my colon there, I was told. And very difficult surgery, but saved my life. It wasn't cancerous, but they said it would not have taken it long to be cancerous. So, but it saved my life, and we're very fortunate that they had this program here to help us out. So.
Christian County has been one of the higher health departments in doing the colonoscopies and the FITs. So proud to say that it's been fairly good. There have been a lot of patients that have come who are already patients of the health department, and so we're very efficient here at getting those patients into the screening if it's needed. And that's been where a lot of them has come from. We've worked with the free clinics also, and patients have come from there. In order to go to a free clinic, you need to be working but uninsured, and it would be at the income levels that would qualify for the program. So there are avenues. Nobody wants to think about getting a screening for colon cancer, but talking to people, you help them understand why they should.